The OR lights were blinding. The patient's chest was open, and the surgeon was on the floor. Dr. Fiona Marsh had been standing at the head of the table when it happened. One moment upright, the next crumpled against the cart of instruments, sending stainless steel clattering across the tile. The monitors screamed. The anesthesiologist, a pale man named Dr. Sutherland, looked at the body on the floor, then at the body on the table, then at the room, as if waiting for someone to tell him this wasn't happening. Nobody did. The patient, a 53-year-old man named Raymond Kofe, lay with his sternum separated and his heart visible, mid-repair on a ruptured valve. The procedure had been 40 minutes in. The critical part, the part that required the most precise suturing, was not yet done. In the hallway outside OR4 at Lakeview Regional Hospital in Thunder Bay, Ontario, a man in gray scrubs was mopping the floor. His name was Solomon Acheampong. He was 34 years old, originally from Kumasi, Ghana, and had been working as a hospital porter and facilities technician at Lakeview for 11 months. He had a mop, a bucket, a laminated ID badge clipped to his chest and, though no one in that building knew it, 8 years of surgical training from the University of Ghana Medical School and a fellowship in cardiothoracic surgery completed in Accra. He heard the instruments hit the floor. He heard the alarms. He looked up from the mop. The scrub nurse, a woman named Terry Halloran, burst through the OR doors and nearly knocked him down. Her eyes were wide. Marsh collapsed. Patient is open. We have no attending. Sutherland is managing airway. I've called for backup, but Dr. Whitmore is 20 minutes out from the highway. She stopped herself, looked at the man in front of her, the mop in his hand. Sorry, she said, like she'd accidentally told a secret to a stranger on the bus. Sorry. She turned back toward the doors. Solomon said quietly, How far into the repair? She stopped. He said it again. The valve repair. How far in? Terry Halloran turned around slowly. What? Was she doing an annuloplasty? Or a full replacement? The words came out of his mouth with the ease of someone asking about the weather. Like he had said those words 10,000 times. Because he had. She stared at him. He was still holding the mop. Annuloplasty, she said, almost without deciding to. Ring in or suture still open. Ring is in. She was halfway through the anchor sutures. Solomon nodded once. He set the mop against the wall, the way a man sets down his briefcase when he comes home at the end of a long day. He looked at the OR doors. He looked at Terry Halloran. He said, I need to scrub in. She looked at the ID badge on his chest. Solomon Acheampong, faculties and porter scraffities. That's not, she started. There are 4 anchor sutures left, he said. Approximating time to Dr. Whitmore's arrival at 20 minutes, plus scrub time, plus reorientation. That patient has a window of maybe 12 minutes before the risk of air embolism climbs past acceptable threshold. I've done 14 annuloplasties, 11 as primary surgeon. She didn't move. I know what I'm looking at when I walk through those doors, he said. You can say no. That is your right. But I need you to decide quickly. For 3 seconds, Terry Halloran, 22 years a scrub nurse, who had seen everything and trusted almost nothing, stood in the hallway of OR4 at Lakeview Regional and looked at this man in gray facilities scrubs. Then she pushed open the door and said, Follow me. What happened before that moment is a longer story, and it matters. Solomon Acheampong arrived in Canada 14 months before the night in OR4. He came through the Federal Skilled Worker Program with a file 2 inches thick. Credentials, references, transcripts from the University of Ghana, documentation of his fellowship, letters from colleagues in Accra. He had performed over 200 procedures. He had published 3 papers. He had, at 32, been the youngest attending cardiothoracic surgeon at Corlebu Teaching Hospital. The first thing Canada told him was that none of that counted. Not exactly in those words. Nobody said it to his face. But the College of Physicians and Surgeons of Ontario sent a letter explaining that international medical graduates were required to complete an assessment process, enter a retraining stream, and pass domestic examinations before being granted a license to practice. The process, the letter explained in measured bureaucratic language, typically takes between 3 and 5 years. 3 to 5 years. He had left a wife and 2 daughters in Kumasi. He had spent every savings they had to make the move. He had told them, 6 months, maybe a year, and then I will be working and we will bring you over. He did not tell them about the letter. He took the only job he could find quickly. Facilities and porter services at Lakeview Regional, 40 hours a week, nights and early mornings. The pay was enough to send something home. The hours left him the afternoons to study for the licensing exams, to file the paperwork, to wait. Every morning he walked into that hospital through the staff entrance. Every morning he passed the surgical wing. He knew what was happening behind every door he mopped past. He knew the smell of iodine and cauterized tissue. He knew the rhythm of the monitors, the way other people know the rhythm of their own heartbeat. He walked past those rooms and he cleaned the floors outside them. And he said nothing to nobody. Some of the nurses were kind to him. Terry Halloran, in particular, occasionally stopped to say good morning, to ask about his daughters. He didn't tell her much. He didn't tell anyone much. He had learned early on that when he started talking about his background, when he mentioned the training, the fellowship, the surgeries, people got a look on their face, a particular kind of look. The kind that wasn't quite disbelief and wasn't quite embarrassment, but was somewhere in between. He had stopped trying to explain. There was one incident, 3 months into the job, that he didn't talk about at all. He had been restocking a supply room adjacent to the surgical prep area when he overheard 2 residents arguing about a procedure. A mitral valve case they were prepping. They had the echo images up on a tablet, and they were disagreeing about approach. Solomon had looked at the image from across the room, through the open door, without meaning to, and he had seen immediately what neither of them was seeing. A calcification pattern on the posterior leaflet that changed the entire suturing strategy. He almost said nothing, but the patient was someone's father, somewhere. He knocked on the door frame. Both residents looked at him. The man in gray facility scrubs, holding a box of nitrile gloves. He pointed at the tablet. "May I?" he said. One of the residents, a young woman, handed it to him. Probably she thought he was going to ask what it was. Instead, he held it and said, in the careful, measured voice he had developed for moments like these, "This calcification here. If you approach from the standard angle, you're going to have trouble with leaflet mobility post-repair. You might want to consider an alternative suture placement, here and here." He indicated the points with one finger. "The repair will hold better long-term." Both residents stared at him. The other resident, a young man whose badge read Dr. Solomon Acheampong, took the tablet back. He looked at the image. He looked at Solomon. He looked at the gray scrubs. "That's very interesting input," he said, in the tone of someone who has decided to be polite at the expense of being honest. "Thank you. I think we have it under control." Solomon handed back the nitrile gloves he was still holding, said, "Of course," and went back to the supply room. He found out later, through the nurse's quiet network of corridor information, that the repair had been complicated, that there had been a technical difficulty mid-procedure, that the patient had recovered, but it had taken longer than expected. He did not say anything about that either. Inside OR4, the monitors were steady, but the tension in the room was not. Solomon stood at the scrub sink and moved through the motions automatically. Nail brush, soap, the count. 30 strokes per surface, anatomical scrub sequence, fingertips to elbows. His hands worked without thinking. This was muscle memory older than his time in Canada. Older than the filing, the waiting, the gray scrubs. Terry Halloran gowned and gloved him in silence. She didn't look at his face. She was, he understood, doing a calculation. What she would say afterward, how she would explain this. Whether what she was doing right now was a catastrophic breach of protocol or the only sane decision in a terrible moment. He respected her for not pretending the calculation wasn't happening. Dr. Sutherland, behind his drapes, said nothing. His eyes were doing the same calculation. Solomon stepped to the table. Raymond Kofi's heart was exposed and still under cardioplegia. The annuloplasty fring sat correctly in position. 4 anchor sutures remained. Their ends tagged and waiting. The kind of clean surgical pause that only happens when the person who was supposed to finish the job is now unconscious on the floor 30 feet away. Solomon picked up the needle driver. His hands did not shake. It was not bravado. It was not performance. It was the simple consequence of having done this before, in a hospital with fewer resources than this one, in conditions more uncertain than this one, with patients who had no other option. He had learned a long time ago that hands only shake when part of you believes there is an alternative to steadiness. He placed the first suture, then the second. "Tension is good," he said quietly, to no one in particular. "Leaflet movement looks normal. He's going to be fine." Terry Halloran watched his hands. She had watched a lot of hands in 22 years. She said nothing, but her shoulders came down about an inch. The third suture. The fourth. He secured the final anchor, checked the ring position, and looked at the monitor. Raymond Kofi's heart, encouraged back to rhythm by Sutherland at the head of the table, began to beat on its own, steady, normal, exactly what it was supposed to do. Solomon set down the needle driver. "He'll need standard closure," he said, "and someone should check on Dr. Marsh." Dr. Whitmore arrived at 17 minutes past Solomon's first stitch. He was a tall man, red-faced from the highway drive, still in his winter coat when he pushed into the OR anteroom and was stopped by Terry Halloran, who told him, in a voice that she had clearly been rehearsing, that the repair was complete and the patient was stable. Whitmore stared at her. She told him who had finished it. He stared at her differently. Then he walked into OR 4 and looked at the monitors and looked at Raymond Kofi and looked at the closed chest and looked at Solomon Acheampong, who was at the sink again, washing out, and who turned around and met his eyes with the kind of calm that only comes from having absolutely nothing to apologize for. "You finished the annuloplasty," Whitmore said. It was not a question. "4 anchor sutures," Solomon said. Ring position was already correct. The hard part was done. Whitmore opened his mouth, closed it, said, "You're in facilities. Yes. You're a porter. I mop floors. Yes. I also have an MBCHB from Ghana, a cardiothoracic fellowship from Corlebu, and 11 primary annuloplasties on record." He paused. "I'm in the middle of the licensing process. I've been waiting 14 months. Whitmore looked at Terry Halloran. She looked back at him. Neither of them seemed to know where to put what they were feeling. What happened in the days after is both simple and complicated, the way most things are that involve institutions and their rules, and a man who doesn't fit neatly into the categories that institutions prefer. The hospital launched a review. This was expected. An unlicensed individual had performed a surgical procedure, regardless of outcome, and that required documentation and process and meetings with very serious people in rooms with very serious furniture. Solomon cooperated with all of it. He answered every question. He produced every document. He sat across from a hospital administrator named Mr. Jeffrey Crane, a gray-suited man who had clearly spent his life being careful and answered questions for 2 hours without raising his voice once. The review concluded, after 6 weeks, that Solomon Acheampong had acted in a genuine emergency under conditions where delay would have resulted in the death or serious injury of a patient. It concluded that his technical performance was, and this was the word the report used, a word that clearly cost someone some effort to put in writing, exceptional. Raymond Kofi, the patient, gave a statement to the committee. He was a retired high school biology teacher from Thunder Bay. He had a wife, 2 sons, and 3 grandchildren. He said in writing that he would like to meet the man who had saved his life. The meeting, arranged through the hospital's patient liaison office, lasted 40 minutes. Raymond was in a wheelchair, still recovering. Solomon sat across from him in a hospital room at the 4th floor. Raymond's wife, a woman named Josephine, sat in the corner and cried quietly for most of it. Raymond said, "They told me you were mopping the floor outside." Solomon said, "That's correct." Raymond said, "And you walked in and just finished it." There wasn't a lot of time to think about it. Raymond looked at him for a long moment. Then he said, "Were you scared?" Solomon thought about it, genuinely thought about it. "No," he said. "I've been more scared filing paperwork." Raymond laughed, and then winced because laughing still hurt, and Josephine said something quietly in the corner that wasn't meant for either of them. The Licensing Review Board received an unusual submission that winter. It came from Dr. Whitmore, the attending who had driven in from the highway. It came from Dr. Fiona Marsh, who had recovered from what turned out to be a cardiac event of her own, a grim irony that she acknowledged with a tightness around her eyes when she signed the letter. It came from Terry Halloran, who submitted a separate personal statement that was, by all accounts, considerably more direct than the institutional letters. It came from the college's own review of Solomon's transcripts, his fellowship records, his published papers, and the documented outcome of OR4. The board convened in February. Solomon took the day off his shift at Lakeview. He was still mopping floors, still showing up at 6 in the morning, still saying good morning to Terry Halloran in the corridor. He dressed in the one good suit he had brought from Kumasi, took the bus to the board's office on Bay Street, and sat in a chair outside a closed door for 2 hours. They called him in at 11:15. He sat across from 7 people at a long table. He answered their questions the way he had answered every question for the past 14 months, carefully, honestly, without performance. At 12:40, the chair of the board, a woman named Dr. Patricia Osibansu, looked at him over her glasses and said, "Mr. Acheampong, the board has reviewed your complete file, including the recent events at Lakeview Regional, and we are prepared to move your application to expedited status. Pending the completion of your bridging examination, which we are scheduling for April, you will be granted provisional surgical privileges in the province of Ontario." Solomon sat very still. Dr. Osibansu said, "Do you have any questions?" he said. "When can I bring my daughters over?" She blinked, said, "I beg your pardon? My daughters, they're in Kumasi, I've been." He stopped, started again. "When would I be able to support a family sponsorship application with provisional surgical privileges?" Dr. Osibansu looked at him for a moment. Then she said, in a voice that had softened just slightly around the edges, "I'd recommend speaking to an immigration lawyer this week." He passed the bridging examination in April. He scored in the 94th percentile. In June, he performed his first official procedure at Lakeview Regional, a valve repair, different patient, different circumstances. Terry Halloran was his scrub nurse. She had specifically requested the assignment. When he stepped to the table, she handed him the instruments without saying anything, and he took them without saying anything, and the procedure went exactly as it should. Afterward, in the hallway, she said, "You know, I had a feeling about you." He looked at her. "When you used to say good morning," she said, "there was something. I don't know. You always looked at the OR doors when you passed them, like you were reading them." He said, "I was." She nodded, like this confirmed something she had never let herself put into words. Raymond Kofi sent a card when he heard about the license. It was a simple card, the kind you find in a drugstore, with a mountain on the front. Inside, he had written, in the careful handwriting of a man who had spent decades marking student work, "You were always a doctor. The paper just needed time to catch up." Solomon's wife, Adwoa, arrived with their daughters in August. Akasua was 9, and Abina was 6, and neither of them had ever seen snow, and Solomon had planned to explain snow to them on the drive from the airport. He didn't get the chance. They landed during the first early flurry of the year, a light, preliminary October snow, barely enough to settle on the ground, and Akosua pressed her face to the taxi window and said, with the absolute authority of a 9-year-old encountering something for the first time, "I know what this is." Solomon said, "You do? You told us," she said. "You said it falls from the sky and it doesn't hurt and it's colder than anything." He had said that. On a phone call, one night, 11 months earlier, when he was sitting in his single room in Thunder Bay after a night shift, and they were getting ready for school in Kumasi, and the distance between those two things felt unbridgeable. "That's right," he said. Abina, the 6-year-old, put her small hand against the cold taxi window. The snow was falling outside. Inside the car, it was warm. "I want to touch it," she said. "You will," Solomon said. "We're almost home. There are people who will read this story and think." He was lucky. He happened to be in the right place. He happened to have the right skills. The door happened to open. But the door didn't open. Solomon Acheampong stood outside that door for 14 months, every morning, mop in hand, watching surgeons walk through it. He could have walked away. He could have found a different city, a different job, a country that moved faster. He stayed. He showed up. He waited without bitterness for the moment when the only right thing to do was to step forward. The question isn't whether you think he deserved to be in that OR. The question is, how many people like him are still mopping the floor outside?